it is their first time, but for those of you who have been with us before, just a bit of a reminder. So we do have captions on this webinar. There's a green button at the bottom of the screen. If you click that, you'll get a new window opening and you'll be able to follow the event there with the live captions. We are, of course, recording as well, as we always do, and we will send you a link to the recording by the end of today, along with any resources that we talk about. Great to see you all chatting in the panel on the right-hand side already. We love to hear what's going on in workplaces, and we want you to exchange any experiences you've got with each other. Always important and always good to share. And we will be taking questions as well from the audience. So if you want to post a question for Shelly, Mike or Dan, you can do that by clicking on the Q&A panel. So on the right-hand side of the screen, there's a speech bubble with a question mark in it. If you click there, that will open the Q&A panel. Post your questions there. I'll put them to Mike and to Dan at the end. So first off, we're going to hear from Shelly, who my colleague here at the TUC, who leads on health and safety. So Shelly's going to give us a bit of an overview on Raac. I'm really looking forward to hearing this. This is a completely new subject to me, and I want to learn what we are, what we're dealing with. So Shelly, over to you.
Thanks very much, Anna. And can you see that first slide there? Yes. Excellent. Hi everyone, good to see you. I know that some of you on this call are reps, some of you will be safety reps, and some of you will be working in buildings where you know there's Raac. Some of you will know a lot about it perhaps, but some of you on this call maybe don't know a lot, and this will be a chance to find out what it is, ask some questions about it. So I just want to start us off really with the basics. So thanks to Mike actually, who provided most of these helpful photos in this slideshow. So we're talking about reinforced autoclaved aerated concrete, which is a construction material. It might be a mouthful to say, and it may look a bit like an Aero chocolate bar, but it's definitely not something that you want to be eating. It is a lightweight precast concrete that is made from sand, cement, lime, and aluminium powder. And the manufacturing process involves mixing raw materials, pouring the mixture into molds, and then exposing it to a high pressure process, which is what results in the formation of those little air bubbles that you can see. It's been widely used for decades, mainly because it's cheap, it's easy to transport, and it's also considered to provide good thermal insulation and fire resistance. However, there are, of course, several structural deficiencies that cause severe risks, which is why we're talking about it now. It can lead to instability, potentially resulting in building failures or collapses, which could, of course, result in serious or even fatal injury. And frankly, it's only a matter of luck that we haven't seen such a collapse that could have caused a loss of life. It is certainly lucky that ceiling collapses in schools that have occurred took place on weekends or during school holidays, and it's unthinkable really what the consequences could otherwise have been. So Raac can also be susceptible to moisture related problems such as mold growth and deterioration if it's not properly waterproofed or adequately maintained, and that then jeopardizes it and any structures attached to it. Of course, a headline over the summer holidays was the risk to schools, reportedly prompted by another collapse, which wasn't made public. And the DFE, the Department for Education, has now identified over 200 schools, but the number of buildings is likely to be much higher than that. Since then, we know hundreds of schools were obviously closed, fully or partially, at the beginning of term. Some of them still are closed. And this has had a major knock-on effect for children and school staff on their access to learning, even their access to food. But on top of that, Network Rail is investigating train station infrastructure, courts and civil service buildings have been vacated, dozens of hospitals have had to close parts of their buildings, tens of thousands of council homes are being assessed across a number of local authorities, and museums, theatres, concert venues have even closed. Others are undergoing checks. Where exactly is Raac found in those places? Well, it's often found in exterior walls, but also interior walls that are used to create separate rooms or workspaces within an office or another building, in roofing or insulation, in the cladding material on building facades, to prevent fires from spreading, the soundproofing walls that you get in buildings such as theatres, recording studios as well, or even residential units, in the construction of pipes and ducts, and in prefabricated constructions. I'm just going to talk you through a very brief timeline on what the government knew and when about the risks. So going back to 96, the UK's building research establishment warned of excessive deflections and cracking and came up with this 30-year lifespan for Raac that we now know is a reality for the building material. In 99, the Standing Committee on Structural Safety urged for inspections in schools with Raac. Long time ago now. And in the meantime, unions began asking questions and asking for action on this because, we saw a period of complacency basically from government agencies, but we knew that there was a problem. Then in 2018, a Raac panel roof in a school collapsed suddenly and with no apparent warning or sign of failure beforehand. And since then, numerous other Raac issues were reported where the material otherwise appeared to be in perfectly good condition. In 2019, the Standing Committee on Structural Safety issued an alert highlighting the significant risk of failure, and an institution of structural engineers study group was then tasked with investigating. Meanwhile, again, unions are sounding the alarm and calling for transparency over this. In 2021, the DfE, Department for Education, published long-awaited guidance. The Cabinet Office also issued a formal warning notice stressing that Raac was now life expired and liable to collapse. By last year, the Education Minister was chasing councils for responses to a questionnaire, while the DfE annual report clearly warned there's a risk of collapse in one or more blocks in some schools. And as we know, this year, hundreds of schools and 7 health trusts are identified as containing Raac, but thousands of public buildings are still yet to be checked. So what have we been saying on this? Well, in September, the TUC published guidance for reps and members to help you understand the risk, everything you need to know about Raac, which you can find on our website, and I'm hoping in the chat very shortly. We also issued a joint union call for a risk register, which, as you can see here, got a little bit of media coverage. And then at our Congress, we issued a statement calling for the government to do mainly 3 things. Plan to rid buildings of structural hazards, ensure buildings are fit for purpose, and make them ready for net zero. And we've launched a tool that allows you to write to your MP, but I'm going to say more about that at the end of this webinar. I also mentioned this before, but we need to also consider the related issue of asbestos in all of this, because any potential collapse or deterioration of Raac could also lead to disturbance of dangerous asbestos-containing materials. Most schools in Britain contain asbestos. Many other buildings besides also contain it. And when fibres of that material are disturbed and released into the air, they can be breathed in, risking serious illness later in life. But also when we talk about the solutions to this problem, if we want buildings to be repaired or rebuilt, we want that done because of both Raac and asbestos, but also any other structural problems, many of these being related. Thanks, Anna.
Thanks for that, Shelley, and of course for that great introduction to Raac. It's certainly an area that's quite new to me, and even though we've heard a lot about this in the news, especially at the start of the school term in September, it's still really good to get an overview. But of course, we're all here from a trade union perspective. So I'm going to put a couple of questions to Mike and Dan first off. So as we said, we think a lot of our audience here today are union reps. So first of all, what are the main issues that workplace reps need to be aware of if they think that there might be an issue with Raac in their workplace? So Mike, can we come to you first, please? And then Dan, I'll ask you maybe what reps shouldn't be worried about. So Mike, what should reps think about in this area?
Okay. So there was an awful lot of information in the news, and there was part of the issue we've been dealing with Raac is balancing the need for information as opposed to kind of sensational news. Thousands of places likely to collapse. The key thing on all of this, that as with any hazard in the workplace, that reps should be asking their employers, what information have they got? Have they undertaken to assess whether or not any of their buildings currently contain this type of concrete? And are they following guidance? And what is their plan for dealing with it? So that's in essence, as the same with asbestos and any other hazards, reps have got a right to ask this. Now, in terms of health and safety legislation, if you're a trade union health and safety rep who's recognised within the workplace and you've got a recognition agreement, you've got extremely strong legal rights to say, actually, want to see this information and I'd like to share it with me. So you can utilise them. In trade union terms, people talk about it as, well, we're talking about under the, within the Brown Book, it says. Many employers won't know what the Brown Book means. So that's the provision of the Safety Representative Safety Committee Regulations 1977, which came about and are specifically mentioned within the Health and Safety at Work Act. So that tells you that the strength of provision to ask for the information, and your employer has a duty to provide this information to you. But that information is also then not just limited to providing it to safety reps, they also have to provide it to non-safety reps and employees who ask about whether or not there's any information the employer should be sharing with them about the risks from their workplace, both from Raac and asbestos.
That's great, Mike. Thank you. So I think that's what really helpful for reps to take away is that as they would with any other hazard, you need to ask your employer for information on this. So as a first step, that's fantastic. But Dan, what do we want to warn safety reps against doing? What do they need to be careful of in this area?
Yeah, thanks very much, Anna, and good afternoon, colleagues. Welcome to everyone here. Excellent summations by Shelley and Mike in terms of the general position, but Raac is quite unusual in that it really needs a specialist expert to identify and confirm that Raac is present. So what we're looking for from safety reps really is two things. It's an initial kind of inspection, preferably a joint inspection, to establish whether there is a potential for Raac to be present. Now, ordinarily, we would strongly recommend that safety reps do this off their own back. Our union policy generally is to do joint inspections where possible, but if the employer decides they don't want to do that, we strongly advise that reps should use the rights that Mike talked about to inspect. This is slightly different because we are very clear that identifying Raac is ultimately the employer's responsibility, and we don't want a position where people are seen to be either scaremongering, as Mike mentioned, or trying to unnecessarily close parts of a building. There are lots of things in a building that may look like Raac, but from our point of view, it's critical, especially given how fragile Raac can be and the potential for collapse risk out of nowhere, that anything that's identified as possibly being Raac is covered by the precautionary principle, which means you assume it is Raac until someone can establish otherwise. So in the first instance, we're looking for joint inspection. If that joint inspection isn't going to be possible, if the employer effectively says no, the challenge back to the employer then is, okay, you go and find someone to do an inspection, but that person must be qualified and competent to do so. And that will mean a structural engineer and normally a member of the institution of structural engineers. One very important thing, because there was some misunderstanding about this when this first became apparent, and again, as Shelley mentioned, this has been going on for a very long time. Raac isn't a new hazard, it's just got more profile. But there was a view in some quarters that actually all you need to do was take up something sharp like a screwdriver or a pair of scissors and poke what you thought might be Raac. And if it crumbled, then effectively it was probably Raac. Now, please, under no circumstances, colleagues, do that for two reasons. Number one, obviously, this stuff can collapse. And the last thing we do is prompt a collapse by damaging the structural integrity of the concrete. But secondly, as both Shelley and Mike have mentioned, there may be asbestos present as well. And in just doing that simple piercing mechanism, you may be releasing those asbestos fibers. So under no circumstances should a safety rep or anybody else actually poke anything that may be considered to be Raac. It's really important that people don't do that because you might be creating both a health and a safety problem. The other thing that we don't want people to do is we don't want anyone to take any liability on for any of this, whether it's risk assessment or primary responsibility for management, unless they are directly employed as either a facilities manager, a safety manager, or a senior manager. So if your role is one of a safety rep, you're only acting in that capacity. What we do need, however, as Mike said, is a provision of information. And even if Raac isn't necessarily present or confirmed in the first instance, this will act as effectively a benchmark for what is there and the condition it's in. So it's really about asking the hard questions. Is there a potential for Raac to be present? Can there be a joint inspection? If there can't be a joint inspection, can someone competent do that inspection? And then most importantly, regardless of outcome, here is the information that you require about what is present, what condition it's in, and what risk it may pose. That, in a nutshell, Anna, is what we're looking for.
That's great, Dan. Thank you for that. A couple of questions off the back of what you've just both said there. So you mentioned joint inspections between the employer and the safety rep or rep. How can the safety reps get a joint inspection done? Are there any tools, any regulations that can help back them up in order to get a joint inspection done? Sorry, to Dan, it came off the back of your presentation. Sorry.
That's fine, Anna. I mean, as Mike mentioned, the primary legislation here is the Safety Representative Safety Committee's regulations, and there are clear powers that safety representatives and rights that safety representatives have under that. Now, as I mentioned, generally we would recommend that people do the inspection off their own back. In this respect, we do think there is a requirement for a joint inspection. So I think two things can be cited here. One is the legislation. And that does go right back, as Mike said, to the Health and Safety at Work Act 1974, the Safety Representative Safety Committee's regulations. There is a requirement to manage risk more generally under the Management of Health and Safety at Work regulations 1999. But outside of that, it's the more general point around the unexpected and unintended nature of Raac collapsing. So not every employer will understand that their structure is potentially made of Raac. Most frankly, until recently, won't have understood what Raac is, where it may be found. So the likelihood in the first instance is a safety rep will be more aware already than their employer and their managers are. We have first-hand knowledge of very large employers in the energy sector that had no idea about Raac until we raised it with them at sectoral fora, and then discovered that their own power stations have this stuff, their own substations, their own offices in some cases. So the reason for the joint inspection really is twofold. One is to make the point that we can go and do an inspection on our own and come back to you with a big list of things that may be Raac that we'll expect you to deal with. But at the same time, we don't want a situation where an employer says to a lay manager, probably an uninformed and unqualified manager, go and do a visual inspection. They come back and say, well, do you know what? The walls were covered in white paint. It's fine. It needs a joint inspection. There needs to be an agreement, ideally, in terms of outcome and process. So it isn't simply about saying, please go and have a quick look around your workplace. It's very much about saying, here's what we think Raac looks like. Here's where we think it may be. Again, it may be roofs, it may be walls, maybe load bearing, there may be water damage, but it really needs an agreement in terms of what's in scope. And our view very strongly would be anything and everything that may be considered to be Raac should be considered to be Raac until you can conclusively prove that it isn't Raac. And one of the things we'll probably come on to later, Anna, is there are lots of other things out there that look similar to Raac but are not Raac. But until that can be positively concluded, again, the assumption should be it is Raac and we should deal with it appropriately and put the highest level of risk mitigation in. Because as Shelly said, it's been very, very lucky so far. No one's been seriously hurt. But obviously a building collapse is potentially extremely serious. So yeah, that's really what we're looking for. The legislation on the one hand, but the severity of the risk on the other hand.
That's great advice there, Dan. Thank you. And we will come back to this, what we're looking for in a second. But a quick question for Mike. I think you mentioned that we assume that it is Raac until we can prove it's otherwise by an expert. What should be put in place if we assume something is Raac, if it's suspected, not proved, if it's suspected in the workplace? What should the expectation be around that?
So again, I think it was Dan that was obviously saying, no, it's okay. So our policy is that, as with anything, if we don't know, we always tend to treat for the worst case rather than the best case. So it's applying what we call the principle of prevention. It's what employers are required to do under law. So because it has been said by the Office for Government Property that should be considered life expired, we can get into discussions of what do we mean by life expired or life expectancy, and liable to collapse. You need to consider that's potentially foreseeable. The employer should consider it's foreseeable that it could collapse with little or no warning, and therefore appropriate things come in place. So if you have a structure where you think this could be liable to collapse, the last thing you want to do is potentially continue its use without any mitigations in place. And what we've seen within education, for example, is we saw the news, people closed, quite rightly, removing people from the area of risk and then instigating potentially assessment to kind of go, well, we think it is Raac, as Dan says, the key thing here is that we're dealing with structural issues, and it needs to be competent structural engineers who've got experience of this, who not only undertake the investigation but provide advice on mitigations to put in place, and that can include things like what we call propping, putting up. You may see them through building sites and what have you, with what we call RSJs, where poles or woods and blocking. But where that's placed and how and what's bearing that load is really, really important as well. And the other thing that, in terms of the continued use, is has there been any other warning signs? Have we got leaking roofs? Are you aware of that? What maintenance has come out from this? All of that information is what was really, really important coming forward. So competent mitigations can only be put in by competent people having done a competent assessment. And until the employer can say, we have therefore undertaken a risk assessment and reassured ourselves that we've applied the principle of prevention and made it safe to be occupied, it is safer for the employer to say, let's err on the side of caution, and we go forward. Part of the problem with this is that because of the specialism in it, there are not extensive numbers of people who are competent in dealing with Raac. So not every building engineer, is a Raac specialist. In the same way as not every health and safety person is a specialist on radiation or things like that. So it's bringing in those relevant people, but because it's in high demand, it's harder to do that. So the conversation with the employer should be, what do we know? And if we don't know and we suspect it, how are we protecting people from from the risk of an unplanned or unforeseen collapse? And one of the pictures Shelly shared, for example, within her presentation, you saw one of the companies that have been dealing with it showing no external signs. So it's not like you can kind of say, oh, well, it's going to show a bit of cracking, a bit of spoiling. When they looked at it, there was a painted piece of concrete that showed no other information, no other sign of warning. When you got inside it, you could see that actually it was a significant risk, and it was by sheer chance alone that it didn't collapse. But I hope that kind of covers it.
It absolutely does. And when if a rep is asking their employer for information, before maybe they can get a structural engineer to do the inspection, what are some examples of information they could ask for? Is it building plans? Is it records of prior inspections? What sort of things can reps get from the employer paper-wise?
So, paperwork-wise, and this is some of the problems that education has experienced. I think it's important to understand the use and the change of ownership of some of our buildings. So now under building regulations, there's a requirement for a folder and information to be transferred across whoever owns that building, so that information is readily available. But definitely within our public sector and some of the kind of third sector estates, these are older buildings that might not be readily available. So you can ask, what do we know? What are our plans? Is there anything written on our building plans? Do we have information for that? When was the last structural inspection of our roofs? What comments were made about the integrity of our roofs? And have we got many inspection records? And is there a life file for the building? So some people may have that already. Some insurers may have already required that for companies to have, so they can say, well, what information have you told your insurer about the structure and the maintenance of the building? But some public sectors are what we call self-insured, effectively, like the NHS, so they won't be required that, but the government have required this information and these surveys to be done. So definitely, if you work for any government-based department, we know that the government and cabinet office have said these surveys have to be done. So asking your employer and say, can I have a copy of what you've sent back to the cabinet office? And if you haven't sent anything back, can you give me a progress update and keep me informed? Within that, but you are entitled under the Safety Committee regulations to see copies of that, and there isn't this, well, we can't share it with you, it's I'm entitled to see it.
And Anna, if I may, just to add very quickly on that, two things. It isn't just the original building that is in scope of this, it's any work that's been done in terms of adding to parts of buildings, refurbishing parts of buildings, potentially reinstating parts of buildings. So we had some initial concerns about this several years ago, Shelly alluded to. And one of the primary sort of learnings at that time was that some duty holders, some employers are saying, well, we know that Raac was used between the 1940s and the 1990s, but actually our building either predates that or was, substantially added to after that date. Therefore, we don't think we're in scope. We don't need to worry. And when we dug slightly deeper, we found that it was the extension to the building that was the bit that had the rack in it, and they hadn't even bothered to consider that because the view was this building's 1930s built. By definition, there's no rack, so it does need to be looked at in the round. The other thing more generally, though, is that, as Mike said, public sector employers, whether it's local authorities, central government, by and large will have some sort of record keeping. They're generally quite good about keeping records just because it's been a previous legal requirement for them. Places where it's more difficult tend to be either ex-public sector, so places like charities, free schools possibly, schools that have been taken out of local authority education and into trust status. There may be more challenges there. But even within that, there should have been some information provision. And Mike's point around insurance is a really important one, because there's a very good chance that at some point, somewhere, that the fact that this stuff was used would have been identified. So there may be a bit of a paper trail there. And it's that kind of question that people need to ask. And as Mike said, it's not just the Health and Safety at Work Act. Section 2 requires employers to give information. The Safety Reps regulations have information provision written all the way through them, either directly or kind of implicitly. And we shouldn't be denied that information. This is a primary safety issue. So it is of the utmost importance. Because the elephant in the room, to a large part, is there may be RAC present, it may be in relatively good condition, but as Mike said previously, as Shelly said previously, this stuff ultimately is life expired. So at some point, there is going to be a problem. It might not be for many years in the future, but it may be an issue at some point. So this point about the benchmarking is a really important point, because you want a kind of rough understanding of where things are now, and you want the evidence to substantiate that. So if there is a problem going forward, you've got it to hand to be able to say you need to act very quickly. And we know that 2 years ago, 3 years ago, 5 years ago, this was the state of play. Things will only have deteriorated since then.
Thanks for that, Dan. I'm going to look now to the questions that have been posted from the audience. And there's you just mentioned about buildings, maybe if they're 1930s or older, the employer or the owner is like, well, it's out of scope. But what about more recently? Is there a date after which Raac would not have been used? Was there a kind of point when it was stopped? I'm not sure who would be best to put this to. Go for it.
So, as Shelly mentioned in her slide, what kind of originally highlighted the issues with Raac was the building research establishment, 1996 research around this. We know that kind of acted as a bit of the soft ban. So in 1996, there were clear issues identified with Raac around, over time, deterioration of the internal structure, both around the metal reinforcement and the kind of honeycomb effect. It was never effectively banned in the way that asbestos was, which was after the state you can't use this stuff anymore. But effectively, by the mid-90s, the kind of substandard nature of the properties of Raac had been identified. So it was already being phased down, if not phased out. But it doesn't mean that it wasn't used after 1996. It doesn't mean that suddenly everything just stopped and ground to a halt. There will still be Raac out there. There will also be, it must be said, Raac that is used for purely decorative purposes, as things like cladding, that doesn't actually add any structural value. And as a result, if it does fail, you might get stuff come off a wall. It's not brilliant. It may cause some minor damage. It's not going to have the same severity as a roof collapsing inwards. So that there is a very complex kind of mix of factors around this. There is water ingress, vibration, exposure to the elements and to weather generally, the degree of which load bearing is happening. All of these things need to be taken into account, and that's one of the reasons why the competent specialism is so important with this. But for any structure, really, from the 1940s onwards, there is a potential for this to be there. And as I said, it needs to be looked at in the round. It may be there's Raac in parts of the building that are not immediately visible, and it may need an inspection to be done that involves going up into loft areas. It involves going to places that have been previously sealed off. Parts of the building that maybe sort of cupboard spaces could have it in. It may have been used because of the thermal properties. So it could be boiler rooms, places like that. And these places are potentially just as liable to collapse in any other area, even if they're not publicly visible. So it does need to be a proper and full inspection. But yeah, there's a broad rule, sort of 1996, but that shouldn't be seen as a hard cut-off date in the way that 99 was for asbestos.
Sure, thank you, Dan. I've got a question for Shelly, because you maybe have a cross-union examples of this. Have we heard of any examples of when people were removed from a Raac site, have their well-being or other issues been taken into account by the employer, or is this something that safety reps need to look out for as well?
That's a really good question. I'm afraid I don't really have any examples of what mitigations have been put in place other than in schools that are mitigations for children getting things like online learning where they've been taken out of classrooms, or meal vouchers where they can't access the canteen. But for the workforce, I'm not sure. And it'd be good to hear if there are any good examples that we can kind of share and publicise. But I think absolutely reps should be on that and demanding mitigations and protections for people that are having their work life disrupted.
Absolutely. Sorry, Dan. I'll just say what we love to hear from what's going on in the workplace. So do please tell us in the chat panel if you've got Raac in your workplace, like what has happened, if you suspect there might be Raac, or like Shelly has said, if you've been removed from your workplace because of Raac, what happened? What did your employer do, or do you think they've not done anything and they should be doing more? We really want to hear about what's going on. So do tell us in the chat panel. Sorry, Dan, what were you going to say?
Sorry, I should make the point that we know of some circumstances, particularly in the health service, where facilities have been taken out of use because Raac has been confirmed, and it has taken some time to put mitigation in place. And generally speaking, two things have happened there. One is that people that could work from home have been allowed to work from home and have been supported to do that. And where the functions meant that you couldn't work from home, there's been temporary provision, usually porter cabins, put into place. Now, obviously, it depends on what the work activity is as to whether you can do that successfully and easily or not. If you're running a major surgery unit in a hospital, frankly, someone will still have to do that surgery. So it's not always as clear cut as saying, right, there are legal requirements to take this out of use immediately. It does depend on the kind of extent and severity of the Raac. But there is quite good practice in place in some areas in terms of managing this well. Again, as a general rule of thumb, the NHS has known about this for some time. They've been quite proactive in terms of identifying and managing Raac. They're not in a position to just close hospitals overnight, a bit like asbestos, but they do have some good experiences, and that kind of thing can be captured. One of the demands that we've made to central government is actually taking areas of good practice and sharing that across government, but it's been difficult to do that. They've not been very forthcoming in giving that information. But there are practical things that employers can do. It really does come down to, as we've said previously, that initial assessment and analysis. But then there are general duties around protecting people's health and their safety, and this is very much a safety issue, that mean removing people from exposure to that risk. So until they can verify that it is Raac, and until they can ensure that it's not going to pose an immediate hazard, it does mean taking people away from that workplace. In most cases, it's not huge numbers. There have been schools where obviously the whole schools had to be shut, and that has switched to home learning. But there are practical things that people can do, a bit like COVID, temporary redeployments, moving to home working, temporary provision of other working environments, even working out of other workplaces where need be. So it shouldn't just be a simple analog case of saying, right, there's Raac here, we shut operations down altogether. There are practical things that can be done. But all of that has and must be done in consultation with the workforce and the unions. That is absolutely essential.
Go for it, Mike.
So I think just to answer some of the questions again about what we do know, and Dan's kind of, and Shelly kind of touched on it. So an awful lot of focus has been on the education environment, and we've been dealing with this for a long period of time with the education environment, and the secrecy from the department has been extreme and getting this information out. So it's really, really important that if you are aware of cases, that you share that information both with the union but also with the TUC, so that we can look at this, because definitely it's not just the initial employee where the kind of the building owner makes decisions. So, for example, if we look at schools, for example, what we're looking at is the risk of, so if a school has to close, and what about the support staff from the point of view of, is that an outsourced provision? So what happens for that? Because actually the Department for Education have said for schools, they'll fund direct costs for the school, but that doesn't necessarily mean they'll give any funding to the source company. Same for school catering, about school meals and how that provision is going to carry on. And we know that there's been issues with school meal provision in terms of for those areas that have been closed. But some of the information that's coming out, we don't find out until the government are publishing the list. And often or not, that is 2 or 3, 4 weeks after they've put some other things in place. And what we've been asking from UNISON perspective, our members to come forward, but again, other education unions and anywhere that's been affected, get in contact with your local branch, with your local organising structure, and tell them what's going on, and ask these questions. What are your plans for dealing with this? How are you going to support the staff? where are you putting then these mitigations in place? It's not just about physical mitigations, it's about saying to what's the impact on people's lives. We've also said to people or parents who've become where schools have closed, where they've then had to transfer into that home learning environment. This is the organising approach around it. How's that employed? How sympathetic have your employers been to the fact of you've now got children back at home again and you're not able to access work, and has there been an impact on that all through this process as well?
That's great help, Mike, but for the education environment, which has obviously received so much of the news coverage. I want to put a question to Dan about, it's kind of another issue. Has anyone highlighted high aluminium concrete, Haac, which has similar properties to Raac? Can I give that one to you, Dan?
Yeah, absolutely. I mean, short answer to that is very much yes. Haac is a slightly different type of concrete, but some similar issues. As the name suggests, it's got a very high alumina content. And that was identified as being particularly problematic back in the 1970s. So similar approach. Government at the time kind of very softly said we shouldn't really be using this stuff anymore. Lots of buildings over time had it remediated, but not across the board. And the problem, obviously, with any kind of concrete is once you've built a structure with it, it's not necessarily that easy to take it out and take it away. It isn't like asbestos where it might be in sort of lagging or on spray coating. It can be integral to the building itself. So we know certainly of a number of schools where Haac is still present and is not in great condition. As Mike alluded to, one of the big challenges actually with the Department for Education is they kind of said we'll throw as much money as we need to on Raac because we appreciate the risk. There are not dissimilar risks with Haac. There is a risk of degeneration over time. There is a risk of structural collapse. I'm not an expert on these by any means. I'm not a structural engineer, but my understanding of it is it's slightly more prominent and obvious with Haac than it is with Raac, but the same issues occur. Haac is effectively now also kind of life expired to a degree. And the DfE effectively said we're not going to put any money into remediating Haac. It's not in scope of what we're looking at. We're only interested in Raac. So it's down to you to manage Haac locally. So ideally, there will be less Haac present in the environment than Raac. It will be managed to a point, but if it is identified, again, similar principles will apply. Specialist engineer to assess, specialist engineer to report back on condition, and then dependent on the condition, then there's mitigations in place or potential remediation, removal, if need be, sort of destruction and rebuild. Again, I think there's been some comments about this in the chats, Anna, about potential Raac as well. The precautionary principle should apply under every circumstance. Because this stuff can collapse with no notice, it can't be assumed that things are safe until we put mitigations in place. It must be a case of saying, right, you act now to reduce risk until you can mitigate properly. And that does mean, unfortunately, segregating people away from areas. It really depends on where the Haac or the Raac may be. It depends on what the implications of that are in terms of safety. Because again, we've heard of certain circumstances where the area where the suspected Raac was actually was one of the fire escape routes for the building. So the whole building had to be taken out of use temporarily until it could be remediated. And obviously that remediation had to ensure you didn't block the fire route in doing so. So these things can be quite complicated. But that precautionary principle really does need to apply, because the last thing we want is a collapse of a roof or a wall that doesn't involve serious injuries and potential fatalities. Can't really stress that enough.
Yeah, great stuff. And you mentioned there about the precautionary principle. But if, say, a workplace has that in place, and then Raac is confirmed, what sort of timetable are we looking at of when an employer must then, conduct a full survey and engage structural engineers and construction to actually fix any issues? Are we talking weeks, months, years? Mike?
Yeah, it comes back to what I was saying before. So you go, whilst they're suspected, it needs a competent person to confirm where it is and to make recommendations and condition. And that could be as quick as saying, actually, you can do the following. It might need complete remediation work. For example, the recommendation could be that whole roof section needs to be replaced, and that then needs to be budgeted for and comes in place. So in terms of what we understand, and unfortunately all we can use at the moment is what's gone on within the health service, for example, or within education, where the mitigations have been put in place with a view for them to being in place for a long period of time. And some of the stuff that's been put in schools, for example, some of the propping work has been designed to have a potential, and I'll use this, of needing to stay in place for up to 10 years to maintain the safety or structural integrity whilst there's a plan put in place. So there's no hard and fast rule which says once you've identified it has to be done within this period, but a plan does need to be put in place for how are they going to manage and deal with it and continue the safe use and occupation of that building, both prior to its use, during its replacement, because of that also then needs to include, given the age, where we are with asbestos or other things, and what implications there are for those alterations coming forward. So some companies, because of the cost involved, may want to look at that over their long-term strategy, but what they can't do is continue to put off the safety aspect of it. So make safe. It might just not be pretty for a period of time, but as long as it's safe and can go forward with a plan in place.
Just to add to that, Anna, if I may, that everything Mike has said there is absolutely spot on. Completely agree with everything that was said. This is one of these unfortunate incidents where the phrase "so far as is reasonably practicable" comes back to bite us, because employers, duty holders can legitimately say there is a shortage of qualified, technically competent people to do these assessments, and as a result, we can't get somebody in for a number of weeks. There's not a huge amount that can be done about that. What we can't have are structural engineers who are not qualified or competent to deal with issues of other issues such as wood wall slabs, ceramic boards that have come up in the chat. It has to be someone that can identify this stuff and identify the condition this stuff is in. And as Mike said, there are things that can be done outside of the actual assessment in terms of mitigating risk in the meantime. We can't really put hard and fast demands in terms of when this is done. The team at Loughborough University, who are the academic experts on this, have made the point that there are potentially millions of structures in the UK with Raac. And even if it's only 1% of those structures that have Raac and it's in unsafe condition, you are still talking about thousands, many thousands, possibly hundreds of thousands of assessments that need to be done. So work is being done by central government, Ministry of Defence, a whole range of different people to try and upskill people to do these assessments, but obviously that takes time. So the issue is not so much the timeliness of the assessment per se, it's making sure people are safe until that assessment can be done. That's a crucial thing, and Mike really summarised that well.
Absolutely. And I appreciate that there may be some people who joined the webinar a little late and didn't hear who these the experts are who can assess for Raac. Can you repeat again, who should the employer be getting in to formally identify Raac?
So I think the key thing is that they need to view this as any other competent person issue within health and safety. So from an employer's perspective, they need to be reassuring themselves that whoever they bring in to provide them advice is competent as defined in health and safety law, which isn't just, well, I've been trained in this. It's about having the sufficient skills, knowledge and experience and application of that to deliver that process. So we would always look to, well, who is that? And that's currently the Institute of Structural Engineers, for example, who we would say are the people who look at chartering, who provide that understanding and that reference listing, who you can cross-match across the table. What are the credentials of this individual? Now, it's not limited. It might be that somebody comes forward who's got significant experience and proven experience in mitigating and dealing with Raac, who may not be a member of the Institute of Structural Engineers, but can provide other information. So we're not wholeheartedly saying it can only be somebody from the Institute of Structural Engineers, but just in general terms, if your employer, because employer and duty holder responsibility is they need to reassure themselves that whoever is providing them information is competent to do so. Hence, the Institute of Structural Engineers.
That's a great base point, I think, for that, to go to that institute. Sorry, Dan, you waved at me.
Yeah, just to add, Anna, that there are challenges around availability. I mentioned before that some employers have used structural engineers that are not really competent to do this. There are obviously going to be insurance liability issues if someone's used someone that is clearly not fit for purpose and then there's an incident. So it's very important that employers understand, and duty holders understand themselves, that responsibility to source competent advice and assessment. There will be kickback on this. There are concerns that people would use the nearest available structural engineer, And obviously there are huge issues around variability with that. They must understand themselves that if there is an incident, if injury and harm is caused, or even if not, if there is a loss of working time, there are potential legal consequences to that. So it's in their own interest to get this right and get someone that's qualified in the way that Mike described.
And sorry, I've just want to come back in because there's been a question put in the question box about internal versus external, and the key thing there is that it's about the individuals acting within their competency. So you may have somebody who is employed within your organisation who is competent to do that, and if you have that and they are competent to do that, and your employer is signing them off to do so. But the key thing is that how you're assessing their competency to do so. So it doesn't necessarily have to be somebody out with your organisation if you've got it within your organisation, but they're few and far between.
Thanks both for that. It's really helpful. I've got a question for the audience now. One of our viewers has asked for tips from other health and safety reps. So that's you who are watching. This viewer has said, in my workplace, Raac has been identified and assessed by structural engineers. So good stuff. But estates have still not provided copies of these reports as requested. What tips do the other health and safety reps have for getting an employer to provide that information? Please post your tips in the chat, because I'm very aware we've got limited time with Mike and Dan and Shelly, and I want to put some more questions to them. So while we're hearing from them, post your tips, please. Okay, I think what we'll do is just pass back to Shelly briefly to talk a bit about what the TUC and the movement is doing on this, because we've had quite a few questions about this. What is the TUC doing with regards to campaigning and lobbying both main political parties? What can people do? Shelly, can you enlighten us on that, please?
Yeah, I am just going to share the final 2 slides of my presentation. So hopefully you can see those. Yeah. Okay, so we've been talking a lot about what you can do in a workplace level, the kind of things you should be asking your employer. But I just want to make it clear what the TUC is asking at a national level, because a lot of this comes down to the government's actions fixing this crisis. So we are asking for 2 main things. First of all, we want transparency about where is Raac? Where is asbestos? What kind of condition is it in? Which buildings are the most risky? Because we deserve to know those things, whether we're working in these buildings every day, or whether our kids or our family members are going into them on a daily basis. So number 1 is about transparency. We want a national risk register. Number 2 is about remedying the problem. We want investment so that our buildings can be made safe, whether that's repairing them or whether it's knocking them down and rebuilding them entirely, and doing that safely. So that's about ridding them of dangerous Raac concrete. It's also about asbestos. It's also about dangerous cladding that's still on the outsides of hundreds of buildings across the country. And it's also about poor ventilation. All of these things are building safety issues, and all of these things are linked. Now, just to finish, I want to promote to you a quick tool that we've come up with, which is just a really simple write to your MP. I'm going to post that in the chat box, but you can also use your phone if you've got it now, if you've got a smartphone, and scan that QR code. It will take you to the page, which is asking you to write to your local MP, which is asking your local MP to write to the relevant minister, but it highlights what we're talking about. What are the risks, and what do we need to do about it on a national level? So do scan that, do get right into your MP, and share that link with your workmates, your union branches, your friends and family as well, so that we can spread the word and kind of keep this issue at the top of the agenda, because it is a national crisis.
Thanks, Shelley. We will, of course, we will share that link in the chat. We'll make sure it's included in the email that will go out to you later today as well. I'm aware that we've got about 10 minutes more, but we're not going to be able to get through every question. But this is a live emerging issue. We will take every question that you've put to us, and we will use it to inform guidance that we put out to workplace reps. Any training that we develop, or information resources, we'll make sure that the questions that are being asked are included in the training. Okay, a couple more questions that have been really popular. So we know that at the moment there are asbestos registers for buildings that have asbestos in, do we see a possibility of building registers being set up for Raac that are similar to asbestos registers? What do we think about that? Who wants to go first, Mike or Dan?
Yeah, I mean, from a GMB perspective, this is something we've called for some time. It again, I think, is important to understand that Raac was never something that was seen as being inherently unsafe until relatively recently, albeit 25, 30 years ago. Asbestos, when it was first used, was deemed to be a magic mineral. There are things being put into buildings now that may have, unintended, unexpected consequences for many years to come. So we do think it's right that there is a building register and a file for every structure in the UK. Certainly, I live in a fairly old house. I presume it's built out of bricks. We know there's no asbestos in there from the survey we had when we bought the house. But I have genuinely no idea for the room I'm sitting in right now what it's constructed of. I know it's got wooden floorboards. Outside of that, couldn't tell you. And that was a private purchase. For any public building, that information should be relatively available to anybody using that building, whether it's a worker or someone that uses it for leisure purposes, whatever it may be. There should be transparency around this because it is a fundamental question of health and safety. I don't think it's unfair to say that the situation with Raac is linked to a degree with the situation we've seen with cladding that Shelly alluded to. And obviously, we all know the consequences of what happened at Grenfell Tower. Much of this has been a failure of regulation as much as anything, a weakening of building regulation, a weakening of health and safety enforcement of regulation. And having that information available, freely available, helps to offset that weakness of regulation to some degree. So we think there's absolutely a case for this. It shouldn't just be high-rise buildings. It shouldn't just be buildings with cladding. It should be all buildings, essentially. We don't think it'd be particularly onerous to do that. The information will be there somewhere. We're not expecting people to go out and get new information as such. It should be available. It's capturing that information, keeping it in a central repository, and giving it to people when they ask for it. It should be as straightforward as that. And we completely support the TUC calls. Absolutely, 100%.
Thanks, Dan. I think that's linked to another question that's about transparency, really, where the viewer has asked, if businesses are renting a building, should this information be known, or do they just ask the building owner for a copy? If there was a register, as you said, you wouldn't need to ask because it would be, the information would be there. But yeah, I think it's all linked to this same issue of finding out the information that we need. Like you said, when you bought your house, you did a survey, but it's a bit different, I suppose, when it's a public building. Okay, there was another question that I wanted to put to you both. Okay. So we've had a viewer who said, we've had a couple of questions, similar kind of theme. If there's a building where Raac has been identified, should the entire building be taken out of use while it is fixed? Or if there's an entry point within that building where there's an area where maybe there isn't Raac, what's the deal there? Because we've had a few questions that are on a similar theme to this. What should workplaces and safety reps be pushing for? Mike?
So, sorry, I just wanted to come back quickly on the other point about from the register as well. So things have moved forward in terms of construction design management regulations, CDM regs, where there is a requirement now for buildings to hold a safety file. But because it's not retrospectively applied, it's having that same requirement that's in existing legislation to provide that information, to have it retrospectively applied so people can have that information. Is that why we need a register and a link and information which is readily publicly available? In terms of where it's been, if part of a building has been identified as having Raac, then the mitigations that need to be put in place, and whether or not that's accessing through that building, if mitigations haven't been put in place, then the avoidance of that area should be put in place. So to take a whole building out, and as Dan alluded to, much of structures can have been amended to and added to over things. So it's about relatively to where that Raac is, what any risk of collapse in that area could impact. So is it actually an exit route? So can you continue to use that exit route or not? Do you now need to follow another ingress exit or kind of route from that process. Is it a store cupboard? So can you just take it out of use and limit that use or access to that area to mitigate? So it really, again, comes back to what I was saying right from the beginning. Risk assessments, having the information and understanding the implications of that use. So there isn't one blanket, there's Raac in that part of the building, the whole building's out and nobody can use it. It's very much about where is it, what impact could it have in the event of its collapse, and who could it affect by that. So it's not, I know it's probably not answers the question as a whole for the individuals, but it's situational based. So there isn't one blanket thing, but just principles, prevention, precautionary approach, treat it as the risk as it exists. In the same way, being careful here, but in the same way as you would take the same risk of, you've got petrol all over the floor and somebody standing next to you with a lighter, you would put mitigations in place. You would say, actually, well, let's clean the petrol up and let's adjust it. That's the same way with Raac. It should be treated in the same way as mitigated and considered a significant risk. Don't know, unless Dan's got any other view or.
No, completely agree, Mike. These things are situational. There should be a risk assessment done on the implications of the discovery of any Raac as much as anything. Many employers will say, well, we have Raac, we've taken the place out of bounds, that'll do. Doesn't necessarily mean that it doesn't create knock-on consequences in terms of other hazards. So all of that needs to be looked at holistically. And one thing I would say, actually, I should have mentioned at the beginning, is you may find that there are multi-union workplaces where one union is more affected than others by a potential discovery of Raac because it affects a certain department or a certain geographic area. It should still be the case, in our view, it's good practice for all unions to be fully involved and fully consulted. One of the most important points about this is working in concert to share information and having like an agreed approach to things. So really across the board, it needs to be one union voice, even though it may be 3, 4, possibly more unions in the workplace. But other than that, absolutely spot on, Mike. Absolutely superb.
Great advice there as well, Dan. I'm going to save one question for a minute because there's a couple of things I just need to say before we do start to wrap up. We've had a lot of questions today, close to 30, which is quite a lot. I knew we wouldn't be able to answer them all, but I think we are going to look to have another webinar about Raac in the next few months. As I said, this is a live issue. It's changing quite a lot. And what we'll do is we'll take the questions from today as our starting point for the next Raac webinar. We'll see if Mike and Dan and Shelly can join us again. Also, if you've enjoyed today, we're having a week today, we're having an event called Union Reps Connect. You basically get the equivalent of this webinar, but again and again and again, about lots and lots of different workplace issues. We at the TUC, we love meeting reps in the flesh rather than via a screen. We like doing both. So we do really invite you to come register. The event is here in Congress House. We'll be giving out these cool little pin badges to say that you have attended. We've got loads and loads of great speakers. Oh, Shelly's got one as well. Some great speakers on the day. We've got updates on employment law. We've got an update from ACAS about mediation. We've got 10 workshops in the afternoon, and you'll get the option to go to 2 of them. The health and safety ones are stress, building a health and safety culture, but we've also got sick pay, we've got using digital tools to organise, we've got disability rights and reasonable adjustments, and that's just the 4 or 5 I can remember. There's another 6. Please do register. The link will be appearing in the chat. Mike and Dan, you're also invited. Please do come. We're having a little reception at the end of the day if you can't come to the bit before that, but we'd love to see loads of you there. Right, that's kind of me done with the plugging. I'm going to put one more question to our panel, which I think is quite an interesting one, where we've been asked, some public services use space managed by another part of public services. So the example we've been given is probation in a magistrate's court, multi-use buildings. Are there any approaches that can be used to hold a landlord to account rather than the employer, bearing in mind there are different employers here? Mike, do you want to go first? You're nodding.
Yeah, so I am. So all of this provision, again, is covered within the health and safety legislation about cooperation and coordination and providing information if you, both to your employees and non-employees, anybody who could be using that building, and if you share that space. So there's already a duty under employers to cooperate and coordinate. So using the example of the probation within the court system, so that's the linkage there is between the HMPPS and the Ministry of Justice, which is their overarching same department, so that there is a requirement for both those employees to be talking to one another, talking about what's being managed and sharing that information across those areas. And that's the same also if we've got a local authority rent out space to a third-party charity, that information needs to be being provided to them in that same way. So there is existing legislation. You've got the rights under the Safety Representative Safety Committee regulations to enact that and to say, what are you doing about this? And to approach your employer to say, well, that information, rather than approaching the landlord on that approach. So that was what I would say from a rep's perspective. Ask your employer where the information is and what they're doing to get it, how it's being provided to you, and don't take no for an answer.
Thanks, Mike. Yeah, great. I love that to finish on. Don't take no for an answer if you're asking for information and working together. We have obviously recorded today. I know some people weren't able to join from the beginning, so as long as you're registered, we will make sure you get sent a link. I think we've had a fantastic webinar today. As I've said, we will use the questions that you've put to us to inform the next webinar we do on Raac. I think it's really important that we do this again soon. So all that remains for me to do is to thank Mike, Dan and Shelly for joining us today, providing so much helpful information. And thank you for your great questions and for exchanging tips and suggestions with each other. I look forward to seeing you again soon, and maybe some of you in person next week on Wednesday. But bye-bye for now and take care.